Medi Talks. Every talk, a health tip.
From ancient times, there's been a deep and mystical connection between serpents and the island of Sri Lanka. Whether we look at Sri Lankan history or Buddhist literature, serpents appear in many significant moments. One of the earliest mentions is from the 6th week after the Buddha's enlightenment, where scriptures tell us that the serpent king Muchalinda shielded the Buddha from a great storm with his mighty hood. Later, the Buddha is said to have visited Nagadipa in Sri Lanka to resolve a fierce conflict between two serpent tribe chieftains, Chulodara and Mahodara. He even made a third visit to Kelania, invited by another serpent king, Maniakita. Even today, many Buddhist shrines are guarded by serpent figures at their entrances, symbols of protection and reverence. Ancient irrigation systems in Sri Lanka are often adorned with serpent carvings on guard stones, a testament to their cultural significance. Before the spread of Buddhism, serpent worship and Naga tribes were believed to be a part of Sri Lanka's spiritual life. We've all heard the story of King Buddhadasa, who performed surgery on a snake to heal it, a tale cherished in our folklore. From prose to poetry, myths to rituals, serpents have slithered their way through every corner of Sri Lankan heritage. In traditional healing rituals and Tovil ceremonies, wooden masks inspired by serpents are still used today. Folklore even claims that betel leaves were a gift from the serpent world brought by a cobra king. And not just in the past, some believe that even in recent political events, a cobra trapped in a plastic bottle in the Killarney River played a mysterious role. From the story of Muchalinda to the legend of the Killarney Cobra, most people know these tales. But today, we're here to share a lesser-known story about a serpent that many have never heard of.
Hello. Today we are going to discuss a topic that most of us need to know, but most of us don't know about: snake bites. We're going to discuss how to identify venomous snakes, what to do and not to do things in snake bite, and preventive measures. This knowledge could save your life or someone you love. Let's learn together.
Sri Lanka. When you think of it, maybe you picture, stunning beaches, incredible wildlife, vibrant culture.
Absolutely, a land just teeming with life.
But there's also this hidden danger, something that sends literally tens of thousands of people to hospitals every single year. We're talking about snake bites.
Yeah, it's a really significant public health issue there.
Wow.
And the numbers, well, they kind of tell the story, don't they?
They really do.
You've got over 100 snake species in Sri Lanka.
Yeah.
But here's the twist. Only about 21, give or take, are actually venomous. Because despite that, they report around 37,000 snakebite incidents annually. That's a huge number.
Wow, 37,000? And how many are fatal?
Tragically, around 100 people die each year from these bites.
Most of these deaths, they aren't because the bite itself was untreatable. Yeah. The real killer, surprisingly often, is just delay. Getting to the hospital too late. Transportation issues, maybe.
That's precisely it. We want to arm you with the knowledge, how to identify the dangerous ones, what you absolutely must do if a bite happened.
And just as importantly, what you absolutely should not do. We're aiming to give you the tools, to keep yourself and your loved ones safer. To start, we need to know who the main players are, right? The most dangerous snakes we need to be aware of.
Right. The Russell's viper, the Indian crate, the Sri Lankan crate, the cobra, the saw-scaled viper, the hump-nosed viper, which has had a bit of an update.
So those are the big six, but there are others too, right? Medium venomous ones.
That's right. There are a couple of other hump-nosed viper subspecies and the green pit viper. They can still cause nasty bites, significant local tissue damage, sometimes systemic effects.
And then mildly venomous ones, like the cat snake.
Yeah, there are about a dozen species considered mildly venomous. A bite might cause some local pain and swelling, but generally not life-threatening systemically.
And it's good to remember the majority, like the common rat snake or the python, are completely non-venomous.
Absolutely. Most snakes you might encounter pose no venomous threat at all.
That's quite the lineup, and knowing how to spot them, even from a safe distance, seems paramount. Let's take the Russell's viper first.
Pretty thick-bodied snake.
Yeah.
Distinct triangular head. And it has this very clear chain-like pattern down its back. If threatened, it puffs up, hisses loudly, puts on quite a display.
Okay, noted. Then the Indian crate.
Any crate. You're looking for a dark body, usually black or deep brown, with very distinct white or yellowish bands going across it. Extremely dangerous snake found across the subcontinent.
And its cousin, the Sri Lankan crate. You described it almost elegantly before: black body, white bands.
Yeah, it is quite striking, typically around 75 to 90 centimeters, thinner than the Russell's viper, quite shiny, short tail.
What's the key behavior to remember for this one?
It's primarily nocturnal, active at night, so encounters are more likely after dark. During the day, it hides away in cool, quiet spots.
Like under logs or leaf piles.
Exactly. Or rock crevices, old buildings.
But there's a critical point of confusion you mentioned, right? An aha moment.
Yes, and this is really vital. There's a dangerous look-alike situation between the highly venomous crate, both Indian and Sri Lankan, and the completely harmless common wolf snake.
Oh, wow. They look similar.
Eerily similar, especially at a quick glance, maybe in poor light. Blackish body, light bands.
So how do you tell them apart? This could be life or death.
It really could. Here's the key difference. The crate, the dangerous one, has single white bands that go all the way around its body, like complete rings.
Single complete rings, okay.
The harmless wolf snake, on the other hand, its bands usually split into two near the belly. They don't form a complete single ring underneath. Places like that.
Got it. And the cobra, well, that's probably the most iconic, right? With the hood.
Instantly recognizable when it flares that hood, yeah. A classic warning sign.
Then the saw-scaled viper, you mentioned it's small.
Surprisingly small, yeah.
Yeah.
Often only about 30 centimeters. But don't let the size fool you. It packs a punch.
What are its key features?
It has this rough, keeled scale appearance, hence the name saw-scaled, and a unique sort of spotted or blotchy pattern. You find it mainly in Sri Lanka's dry zones.
Okay. And lastly, the hump-nosed viper. You said there was an update.
Yes, this is important. It used to be considered only moderately venomous, but the science has evolved, more clinical data came in, and it's now firmly classified as deadly. Its venom can cause severe kidney injury, among other things.
Wow, okay. And how do you spot it?
It has a very distinct upturned snout, that hump nose, and it often holds its head up off the ground at maybe a 45-degree angle. That posture is quite characteristic.
Oh, let's say the worst happens. Despite precautions, someone is bitten. What is the absolute non-negotiable first step?
Get medical help immediately. Full stop.
No hesitation.
None. This is the single biggest factor influencing survival rates. Forget everything else for a second. Getting to a hospital with anti-venom capability is priority number one. That message needs to be loud and clear.
Okay, so you're calling for help or starting to move towards help. What are the immediate first aid steps while you wait or travel?
First, get away from the snake. Sounds obvious, but prevent a second bite.
Right.
Second, and this is crucial, keep the victim calm and still as possible.
Why is stillness so important?
Because movement, panic, increased heart rate, that can potentially speed up the circulation of venom through the body. So keep calm, lie down if possible, keep movement minimal.
Makes sense.
Quickly remove anything tight from around the bite area. Rings, watches, bracelets, tight clothing. Swelling can happen fast and dramatically, and those items can become constricting.
Good point.
And if you can, try to immobilize the bitten limb. Don't elevate it necessarily, just keep it still, maybe supported. Use a makeshift splint if you can do it quickly and without causing more movement or distress.
Okay.
Now, equally important is what not to do. There are so many dangerous myths and folk remedies out there.
Yeah, let's debunk those. What's on the never ever list?
Top of the list, don't cut the wound, don't try to suck out the venom.
You see that in old movies all the time.
I know, but it's completely ineffective at removing any significant amount of venom, and it massively increases the risk of infection. Plus, you're causing more tissue damage right at the bite site. Just don't do it. Avoid applying tight bands that completely cut off blood flow. But completely cutting off blood flow can cause severe damage to the limb itself, nerve damage, tissue death, potentially leading to amputation later. It can concentrate the venom locally too, worsening tissue damage there.
So definitely no tourniquets. What about applying stuff to the wound? Ice, heat?
No, avoid ice, avoid heat, avoid electric shocks. Definitely no alcohol. It can interfere with assessment and treatment. And generally avoid giving anything by mouth unless directed by medical professionals.
What about traditional remedies, herbal pastes, things like that?
This is a really critical point. Do not delay seeking proper medical treatment to try traditional or unproven remedies.
That delay could be fatal, right?
Absolutely. The only proven effective treatment for significant envenomation is anti-venom administered in a hospital setting. Wasting precious time on ineffective remedies is incredibly dangerous.
So the goal is always the hospital. What happens there? What's the medical lifeline?
The cornerstone of treatment for venomous snake bites is anti-venom, or anti-venom. You hear both terms.
And the good news, as you mentioned, is that it's actually available for most of the really dangerous snakes in Sri Lanka.
Yes, that's incredibly encouraging. It covers 5 of the big 6. Russell's viper, both crates, Indian and Sri Lankan, cobra, and saw-scaled viper.
And it saves lives regularly.
Countless lives. It's a game changer. The main exception noted in the sources is the hump-nosed viper, a specific anti-venom, for it isn't as widely available or routinely included in the standard polyvalent antivenom there. Treatment for its bite relies more on managing the specific complications.
Okay, so antivenom is key. Is there more to the hospital treatment?
Oh, definitely. It's not just about injecting antivenom. Doctors need to carefully assess the patient, determine the type and severity of envenomation, because not every bite from a venomous snake results in venom injection.
Right, dry bites.
Exactly. They manage symptoms like pain or breathing difficulties. They monitor the patient closely with lab tests, checking blood clotting ability, kidney function, electrolytes, things like that. And they treat any complications that arise, like infections at the bite site or organ damage.
Understanding how the venom actually works on the body seems helpful to grasp the danger. How does it differ between snakes?
Some snakes have venom that's primarily neurotoxic. It attacks the nervous system.
Like which ones?
The kraits, both Sri Lankan and Indian, and cobras are classic examples. Their venom can interfere with nerve signals to muscles.
Leading to?
Symptoms like drooping eyelids, difficulty swallowing or speaking, muscle weakness, and in severe cases, respiratory paralysis, which is obviously life-threatening. Russell's viper venom can also have some neurotoxic effects.
Its effect on blood, hemotoxic.
Precisely. Viper venoms, particularly Russell's viper and saw-scaled viper, are notorious for disrupting blood clotting. They can cause spontaneous bleeding, internally or externally, and damage blood vessels. This can lead to shock and organ damage.
Okay, so nerve damage or blood clotting problems. What about effects right at the bite site?
Yes, local tissue effects are common, especially with cobras, hump-nosed vipers, and green pit vipers. Their venom can cause intense pain, massive swelling, blistering, and necrosis. That's tissue death. It can be incredibly damaging locally, sometimes requiring surgery later on, and infection is a big risk too.
It really drives home why prevention is just so critical. How can people live more safely alongside snakes, especially in a place like Sri Lanka?
It really starts with understanding snake behavior and habitat. They're often attracted to places that offer shelter and food, which means potential prey, like rodents. So think stone piles, garbage heaps where rats might feed, firewood stacks, piles of coconut fronds or roots, piles of timber or building materials. And remember, the Sri Lankan krait's habits nocturnal, resting in cool, quiet spots during the day.
Okay, knowing their preferred hangouts helps. What about practical safety steps? What are the top recommendations you took from the sources?
Number 1, absolutely number 1. Never touch or approach any snake, even if you think you know what it is, even if it looks small or harmless or even dead. Just give all snakes a wide berth. Respect their space.
Simple but effective. What else?
Use light. Especially when walking around at night outside your home in rural areas, use a good, strong flashlight. Many bites happen when people accidentally step on snakes they didn't see in the dark. If you're working in fields, gardens, forests, or even just walking through areas with tall grass or leaf litter, wear proper footwear. Sturdy shoes, ideally boots that cover the ankle or higher. Sandals or bare feet are just asking for trouble in those environments.
Good advice. And you mentioned tidiness.
Yeah, keep the area around your home as clean and clutter-free as possible. Remove piles of rubbish, wood, or stones where snakes might hide and rodents might live. Keep grass trimmed short near the house.
Anything about keeping them out of the house itself?
Definitely. Seal up any potential entry points. Check for gaps under doors, around windows, holes in walls or foundations where snakes could potentially slip in, especially smaller ones.
And finally, something crucial for families.
Educate children. Teach them about the danger of snakes. Show them pictures of the common dangerous ones if possible, and drum into them the rule. Never touch a snake. Tell an adult immediately if you see one. Knowledge is protection.
It really is. Snake bites are a serious issue in Sri Lanka, no doubt about it. But the most powerful message seems to be
That fatalities are largely preventable. With the right knowledge, proper prevention habits, and most importantly, getting prompt medical care, the outcomes can be drastically improved.
And it's worth remembering that surprising fact we uncovered the majority of snakes there, actually over 60%, are harmless to humans.
Yeah, a full 63% are non-venomous. So it's not about being terrified of every snake. It's about informed caution, knowing which ones are dangerous.
Understanding the specific dangers, knowing how to react, knowing what not to do, it allows for a safer coexistence, doesn't it?
Exactly. It fosters respect for the wildlife while prioritizing human safety. It's about living alongside them more safely and sustainably.
And that really brings us to a final thought, perhaps. The power of sharing this knowledge.
Absolutely. Public education is key. Dispelling those dangerous myths about cutting or sucking wounds or relying on ineffective traditional cures, that saves lives. Making sure people know the importance of getting to a hospital fast.
So the real antidote, in a way, isn't just the anti-venom in the hospital vial.
No, you could say our collective understanding is the most powerful antidote. Think about it. If you share just one key thing from this discussion, maybe the crate versus wolf snake difference or the importance of immediate hospital care with your family, your friends, your community, how many lives could that potentially save? That shared knowledge is what builds a safer future.
Wow, this has been quite the deep dive. It's fascinating how these creatures are such a vital part of the ecosystem.
Absolutely essential ecologically.
And yet pose such a significant threat to human health in certain circumstances.
It's that complex intersection of biodiversity and human activity.